Everybody ready? Best part. If we haven't met before, I'm Dr. Jared. I'm the founder of our clinic. I do want to appreciate your time this morning. I know you all took time to be here. The reason we started a group is very simple. What I'll show you this morning over about 30 minutes are both normal and abnormal x-rays with a purpose, but when you look at your x-rays or that of your spouse, you should know, number one, exactly what you're looking at, but more importantly, how it affects you and your health. Because most people come here for pain. Headaches, neck pain, back pain, top 3 reasons that people seek chiropractic treatment. So it surprises people sometimes when their acid reflux goes away, or they sleep better, or something that you may have never associated with going to the chiropractor before improves. And one of the reasons that happens so frequently, and I would say what I feel is why it happens so much more frequently in our clinic, is very simply we work to change the shape of your spine to give you a more long-term improvement. And that takes a special skill set. Now, I do always mention I was one of the people that went to the chiropractor in no pain. So unlike most, I went to the chiropractor for asthma. And not asthma I'd had my entire life, but asthma that I developed after a weightlifting injury. I had a friend of mine drop a 125-pound weight bar on the left side of my face. Now, obviously it was an accident, but I was at the Freeport YMCA. It was almost 20 years ago now. I finished a set, handed it to my friend. There were 3 of us working out, and so he was talking to the person to his right. It hit his hands, and right as I turned right and went to sit up, the bar landed right here. It hit hard enough that it bounced. You can imagine that. I have a scar up here in my forehead, but was rushed to the hospital. Had a CT scan. It showed 7 fractures in this left side. That's how hard it hit. And within a week I had full titanium plates inserted in my face for structural support, and then a 6.5-hour plastic surgery to make that left side look normal. And one thing I always say is I feel like they did a pretty good job. I've never had anybody notice. It's all fake or reconstructed. But what happened, and the reason I tell you that is that when I went to see my surgeon about 3 weeks later, they said, you're never going to have another problem with this again. And I have not. Like I said, it's been almost 20 years, full titanium plates in one side, major reconstruction. But what did end up happening is it damaged my neck because I was sitting up as it happened. And so similar to somebody who gets in a car accident, similar to somebody who gets like a football injury or some sort of sports injury, slip and fall on the ice, because I was leaning forward, when it hit, it snapped my head back and caused whiplash. So it damaged the ligaments in my neck, which over the next 4 months allowed my spine to shift way out of place, and it started to pinch the nerves. And when most people would associate that with having neck pain, I was running and all of a sudden couldn't breathe. So I had a severe asthma attack. I did what most people would do. I made a doctor's appointment. I went to my family doctor. They sent me to a specialist. I ended up seeing 12 specialists for this problem. I tried all these different medications. It took 3 different prescriptions, including a very strong inhaler, just to be able to breathe enough to run or to be active. But they said, you're just going to deal with this forever. Now, the good part is I was lucky enough, I had a friend of mine recommend I try something different, and that was when he brought me with this chiropractor. And what I can tell you is, if you remember nothing else from today, I would ask you to remember this. He said, my first chiropractor told me, our goal is not just for you to feel better, but ultimately to get your body to heal itself. And that was a very different concept, because I had been told, deal with it forever. Right? So when I had x-rays, just like you're all here to see, there's an ideal position of the spine that protects your neurology. Straight from the front, 45-degree curves from the side. The x-ray, the side view x-ray of my neck, instead of being this ideal 45 degrees, it was -11. Now you can imagine if you're bending the wrong direction, how much pinching or how much pressure that's going to create. But again, pinched nerves don't always equal pain. And yet most of the time we think of a pinched nerve being a pain cause. Only about 10% of your nerves feel pain. So you could have a pinched nerve be miserable, you could have terrible headaches or back pain or whatever. You could have a pinched nerve and have asthma. And like I said, these nerves were pinched. Over time they developed into this. Now the good part is again, when I found the right answer, I found the cause of the problem. Within a year, I was able to get off all 3 of those medications. I play basketball 2 to 3 days a week. I'm able to run, work out. It's not limiting, and it's healed. And the whole idea is ultimately, again, to heal yourself. Now, most of you probably are here for asthma, but this upper part of your neck, this is what causes migraines. Causes a lot of people to develop headaches. It also affects things like your sinuses. For sinus and allergy issues, goes to the ears. We see tons of kids that have chronic ear infections that start to get adjusted and they stop having ear infections because it balances the fluid And this is where your brainstem sits, so it can affect how deeply you sleep, it can affect your serotonin, it affects all different hormones. The middle part of the neck can cause neck pain, or it affects your thyroid, so it can affect your metabolism, your energy. The lowest part of the neck, the most common things that people feel are like they hold their stress. If you ever heard somebody say, I hold my stress, typically that's from misalignment in the lower neck. These nerves go into your arms and hands, they go to your lungs like you just saw, they also go to your heart. If this is brand new for you, if you've never heard anything even remotely like this, think about this for a second. Almost everybody I talk to, they know if somebody's having a heart attack, one of the first warning signs or symptoms of truly a heart attack is what? Numbness in your arms, right, or pain. The reason is because when your heart gets that much stress, it goes through all your neurology and affects everywhere those nerves go. So because you're having a heart attack, your arm gets pain or numbness. It's the exact same nerves. So think about if you're pinching enough to chronically hold your stress or have neck pain, what else that could be affecting very silently. Middle part of the back, again, we're going to start to go a little faster, but it goes to your digestive tract, so things like acid reflux, indigestion, back pain. Lowest part of the back, this is the most common area to wear out as someone ages. It's the most common area to bulge your disc. It's the most common area to get arthritis. Not only can you have back pain, but the bottom 5 nerves in your back, they branch out into a nerve called the sciatic. So I'm sure everybody's heard of sciatic nerve. Some of you have felt it before, but it can go down your legs. It can affect pain. It can cause numbness. These same nerves go to your intestines, reproductive, adrenal, kidneys, bladder, and ferment the prostate. So like I said, anywhere you have a pinched nerve, you absolutely can have pain, but hopefully you can see why you could have so much other things improve. Now here's the very last stat, and then it's just all x-rays from there. And I show this because I hear very frequently the saying, well, why do I have this now? I hear that question a lot. How come I have this now? Or you might hear somebody say, you know, after I turned, let's say 40, it was all downhill. You ever heard somebody say, I got 3 medications, 3 issues, whatever? Well, here's from a functional perspective, this is how your body expresses health or symptoms. If 100% function is perfect health and 0% is death, on average, you have to lose 40% of the function in an area before you feel it. So think about that. From here to here, you feel the exact same. This is why people tend to have issues as they age, because by the time you get to here, this is where the symptoms happen. Now, there's a few things about this. Of course, your body's always trying to heal itself, so you could develop a symptom and your body could heal it. You've probably all experienced that at some point before. But many times, if you can't ignore it anymore, or if it's a more serious problem, again, the American standard approach is to seek medical treatment, right? To go to a family doctor. I would say most people know that. You've probably done it. Now, if you go to your doctor for a chronic health issue, 90% of the time you're going to walk out with what?
Medicine.
A medicine or a prescription. Now again, it could save your life if you're having a heart attack, a stroke, if you're in a car accident, but unfortunately it manages the symptom, it doesn't improve the function. This is why people tend to have more and more medication or stronger doses over time, because if, let's say you use a blood pressure pill or an asthma medicine, if you're on that long enough and your function continues to decline, you're going to need a stronger drug to get the exact same outcome, because functionally you're getting worse even if you feel the same. Now, I don't think anybody's here for that, so we're going to move forward here, but this is the most common thing. We see a lot of people, in fact, I would say it's almost trained in our country to base your health on how good you feel. Right? If you feel good, most people assume they're healthy, not in pain, not on a bunch of drugs. Now think about this, if you start to do something like get adjusted and fix the problem, but when you get to here, you're really going to feel pretty good. That's why we see some people get improvement in their first adjustment. Everybody feels better within a few weeks. They start to see progress, right? Now, think about this. If you stop what causes the problem, or what's fixing the cause of the problem, but you keep the same lifestyle, the same habits, the same things that cause it, in most cases, unfortunately, it doesn't take that long to go back. And this is where we see people have chronic issues like arthritis in their back, bulge or herniated discs, more serious health problems, because they never really fix it. Now, the reason we ask you to take this extra half hour here this morning before we go over your treatment recommendations and your x-rays is very simply, our goal is to get you as close to here as is physically possible. Then you decide if you want to maintain it. But this actually will get you the outcome that you want, and it will be more long lasting. So, with that being said, we're going to go over about 11 x-rays here. It typically takes about 18 minutes, so we're going to go through a lot very quickly. Starting at the top. So this is a side view of the neck. Teeth are here, back of the skull. That's a perfect 45-degree curve. A neurologist coined that the arc of life, most important curve in your spine. Now, one of the reasons it's the most important is because it's the closest to your brain. So for your brain to send a signal to your big toe, to your colon, your heart, most of the signals go right through there. An excellent example of that would be Christopher Reeve. How many people remember Christopher Reeve, out of curiosity? If you don't, he played Superman on TV in the 1970s. Who remembers how he broke his neck?
Fell off a horse.
Fell off his horse. He fell off a horse, snapped his neck right here, right between these two bones. And as majority of you know, he never moved his arms or his legs again. He was in a wheelchair the rest of his life. But just to stay alive, he needed a pacemaker, respirator, feeding tube. He had a hole in his colon. And the reason is because damaging his spinal cord, his body couldn't tell his organs to function properly. Right? So he needed all that intervention to stay alive. And he raised millions of dollars for spinal cord research. In fact, he helped to develop what they call a diagnosis called accelerated aging. If anybody's ever heard of that before, it's basically aging faster than your body should. If you read his autopsy report, which is in his book that you could buy on Amazon, it states that he was 30 years older than his biological age when he died. So he was only paralyzed for 9 years. He aged almost the equivalent of almost 40 years in that time. Now think about why that would be. His brain can't tell his body to heal. Well, obviously nobody here has a broken neck, but here's something a lot of people don't realize. The ideal curve, like you're seeing here, allows your spinal cord to be relaxed. If your spinal cord is relaxed, there's a lot more effective healing. As you straighten her, if you lose that curve, it stretches. Just like if you stretched a rubber band. Now, if you stretch a rubber band long enough, everybody knows the fibers start to thin. It gets more brittle. And I'll actually show you some examples of that. If you lose 50% or more of the curve in your cervical spine, in your neck, your spinal cord will start to thin, which accelerates your aging. So again, this is when we started how you could have neck pain improve or your back pain improve and actually get healthier as well. That's why. So two other things very briefly. Your brainstem is the only part of your brain that doesn't sit in your skull. These two bones that look different than the rest, they have to be parallel to the skull, and there has to be very large open spaces. That's normal. The rest of these spaces are called disc spaces. Again, most people have heard of a bulged or herniated disc. Discs feel nothing, but the nerve comes out right behind here. Now, if I show you the disc on your spine, discs repair. Discs are these spongy things right here. So discs repair or refill with movement. Now, it's been proven that your discs should last at least 140 years. So if they're supposed to last 140 years, how come so many people have disc problems? The reason is very simple. Because they don't have a blood supply and they have to repair when you move, if you get subluxated or if you get misaligned and that bone doesn't move anymore, let's just say you lose the curve. Can everybody see if you lose the curve how those start to scrunch? And your hips shift, whether you sit at a desk at work, whether you work physically walking around, whether you like to exercise and run, how much more quickly is that going to wear that disc out? Does that make sense? Now, if you get a shot, if you take a pill, if you go in and have surgery and they clip that and you keep the same alignment, this is why that problem continues to come back for so many people. And so until you fix the actual structure, it's going to continue to cause problems. And that's what we're so proud of here is we work to change the structure of your spine so you get that more long-term improvement and don't put pressure on your nerves and feel better and stay healthier. Now, there's 4 phases of degeneration or subluxation. This is again normal. You can see the curve. You should see these big open discs. This is a cadaver next to it, so it's the same person. So here's the spinal cord. The one thing I want you to note, look how much space there is around the spinal cord when there's a good curve. All those discs, again, that's normal or ideal. Phase 1 is any shift outside of normal that will not heal on its own. You may or may not feel it, but again, you can see there's no arthritis, but there isn't much difference, and notice the difference in the spacing here. Phase 2, another term for phase 2 is called early stage arthritis. So this is where, see the normal? Can everybody see how those are so much smaller here? So you can see there's spurs, there's disc thinning. Now, in this position, this takes 10 to 20 years to even look like this. This is how problems can sneak up on you, is because it takes so long for you to feel it, unless you're in a very serious accident like a car accident or something. Now, you can also notice it here how those bones are growing out. The good part about phase 1 or phase 2 is they're 100% reversible. You can completely correct the spine, you can change the shape, you can eliminate the symptoms, all those things. And it does not take near as long to correct it as it took to get there. The easiest analogy I can share with somebody is braces. So if you ever known somebody that has braces take 2 to 4 years. National average is $6,500 to fix your teeth or fix your smile, whatever you want to say. Now everybody knows this, but I have to ask, what if by the time 1 year goes around and somebody has braces on, their teeth are pretty straight usually? What would happen if you took the braces off?
They move back.
They move, completely change the shape of your spine. And again, that's not what we go through here this morning. This morning is based on what you came in with. So it's what we call a corrective plan, ranges between 3 and 9 months, depending on what you came in with and the severity. It will get you the symptom relief you want, it will get you the majority of the correction that you need, and then from there, that's when you decide about continuing or maintaining to get the rest of the changes that you want. Phase 3, this is not fully correctable. This one, can everybody see how gnarly or how adapted those bones look? See the big bone spurs here? If you've ever heard somebody say they have a degenerating or a degenerated disc, that's what those look like. It's because there's no movement, there's not fluid. Now, if somebody says it's because I'm getting old, well, look at this disc. This disc is the exact same age as this one, so how come this one's normal and that one's deteriorated? Right? It's based on the misalignment or the lack of movement. Now, the good part about this is you're going to, on average, get at least 80% improvement, even if you're at this point. It takes 20 to 40 years to get there, and you get improvement way faster than that. But if you don't fix it, again, it can fuse. So this is not a surgical fusion, but a degenerative fusion. Can everybody see how you can't even see the front of the disc anymore? Now, remember when we talked about accelerated aging or the spinal cord? Can everybody see the difference in the width here? How little space. So this person is sick, suffering, they're on many medications, they're in pain, and yet, how did that happen? It happened over time. It slowly happened over time. And I can tell you, because somebody that's in phase 4, we do not adjust in most cases. We don't expect the result because it's fused. But I will tell you, in the people that I've seen that have this, there's a consistent pattern. Like I said, they're in a ton of pain, they're on a lot of medications, they're often very sick. But also, when I tell them, they'll say, you know, I knew I should have done something about this sooner, right? How many people have ever said that when I knew I should have done this sooner? And then there's usually a but, and everybody could probably fill the but. You know, but I was busy, but work was stressful, but finances were tight, but there's something, and it's understandable, but unfortunately the health, if your health is your greatest asset, your health is not correct when it's convenient. It has to be corrected when there's a problem, and maintained hopefully when there's not. Now, we're going to start to look at progressive loss. So we're well over halfway through the x-ray portion here. So can everybody see the progressive loss of curve right there? So think of it, this is the first x-ray you saw. This is Joe. He put on his first paper he wanted to enjoy retirement. This is Sarah. If you want to stand, stand.
Yeah,
if you're
can't
paying,
say
absolutely.
no.
So, and then this is actually when I mentioned whiplash. Everybody see how it's bending the wrong way right here? So, part of why I show these people is, first of all, age. Dan is 63. I just adjusted him this week. By all medical terms, he's in perfect health. No drugs, perfect blood work. He brought it in last year, and no pain whatsoever. And he's been like that for a long time. We've been maintaining his spine for over 6 years. Joe is 72. Since he was first brought in, I say brought in because his wife made him come. If anybody have ever done that before, his wife was insistent that he come, but he's been coming for over 8. He mows his lawn, he fishes, he hunts, he does everything he wants to, and he literally wrote, enjoy retirement. Sarah is 17. At 17 years old, she gets migraines. Now, can everybody see the spatial difference? So when I say she gets migraines, can you see why that potentially would be? Allergy and sinus issues. She's the one with neck pain. She takes Tylenol or Advil every day. And keep in mind when we're showing the phases, this is phase 2, and this is phase 2. These two people are 55 years different in age. So both are 10 to 20 years to develop that. Now, that's why we say it's not how old you are, it's how long the problem's been there, how aggressively it's happening. The other tough part for her is that she has no idea what caused it. So we had a radiologist look at this. They stated that it had been there probably 15 years or so, Everybody can do the math there, right? If you have kids especially, a little. Now think about how often your kids fall. You know, how that kind of, so, but she has no idea what caused it, yet she didn't have neck pain until she was 12. She didn't have migraines until she was 15. But now by the time I meet her, she's on 4 different drugs. She's in a lot of pain, she's having many issues. But here's the good part, and this is my favorite part, by the way. Not only will you feel better, but you're going to see progressive exercise. You'll see objective changes. And so if somebody asks me, well, I've been to a chiropractor before, and a lot of you have been to a chiropractor before, what's different? If I only had one thing, I would say, we're gonna look at your progress. We're gonna make sure you'll get objective changes. And so this is a 9-week x-ray for her. So everybody see the difference right there? She had 1 migraine that her 3rd month. She was having 3 to 5 a week, taking a medication to try and stop it when she first started. Just going from reverse to straight is enough to reduce her neck pain enough she stopped taking painkillers. Remember how we talked about if you have motion, your discs can heal or open up? Did everybody see the difference in the spacing there? Now again, that's your body healing itself. The last thing that I want to mention though, to accomplish this, it does take some work. It takes some consistency, it takes some effort. Braces, you glue metal on your teeth and somebody tweaks those periodically. You're certainly not leaving here with a brace or something like that, but what you do have is consistency of treatment. So the average adult starts at somewhere between 2 and 4 days a week to get the outcome that they need, and it progressively drops down. So if you look here and I say Sarah's had to start at 3 days a week to make these changes, can you start to see why that would be necessary? Now I can tell you by the time she's here, she's coming twice a week. Shortly after that, she was at once a week. She now comes twice a month in maintenance. She's doing great, she's off all her meds, but again, it takes time in the beginning. And the reason is, just like with braces, when you move your teeth, it's not just turning your teeth, it's all the structure. It's the structure that has to change. With your spine, you're not just aligning the bones, you have muscles, you have ligaments, you have muscle memory, adhesion, scar tissue, possibly arthritis. It all has to change and adapt for you to get a long-term improvement. Very last 2 x-rays, and then we're gonna go over yours. These are from the front. Candidly, I only show 2 x-rays from the front because most people know if your hips are off or your spine's crooked from the front, it's gonna cause a problem. So here's the center line. Can everybody see the curve in her back? It's harder to see, but her right hip is way higher than her left hip. So again, it's creating this curve. Now think about for just a moment what she might deal with. And whatever comes to your mind, nobody needs to state, because I've done this so many times. The top 4 things are back pain, sciatic problems, digestive issues, or breathing. Those are the 4 things most people say. But what I want you to realize is, this is a 6-year-old. 6. She has no pain, she has no problems, she's on no drugs, she doesn't really miss school. She's here because her mom is. Her mom was in a lot of pain, her father had headaches. Everybody else in her family was here getting adjusted except her, because she was the little vibrant kid. When the rest of them switched to maintenance, that's when she started to get adjusted. And her parents had her x-ray assuming she was perfectly healthy. Because of course, if you have no pain, most people are trained to think about. So what's the difference between this and her being sick like every other person in her family? I'm going to point at it from, this is the first thing we went over. It's function. It's just the amount of time it takes for it to develop. This is her 4-month progress x-ray. Now keep in mind, medically, no symptoms to no symptoms, but if you knew nothing about her, and I said which person's healthier, how many people's mind goes to the right? Now, I know that it does, I mean, universally, but think about why your mind assumes that that person's healthier. And the reason is ultimately it's prevention. In the proper alignment, your neurology works better, and if you function better, you heal better, it improves your immune system, it improves your function, it reduces your pain, does all that stuff. But the tough part is pain is a pretty good motivator. For those people sitting here in pain, I know it's sometimes very difficult to even be sitting, but ultimately pain is a very good motivator. This is more philosophical because she'll never know what she would have had because she's never had it. Right? It's the reason I adjust my children personally. I mentioned to somebody this morning, I currently in this clinic alone adjust everyone from my 88-year-old grandfather through my 8-month-old daughter, and I take care of about 20 family members. Most of them not because they're sick, most of them to stay healthy. Right? Because everybody believes in preventative medicine. I don't know a single person who doesn't believe you should try and prevent it if you can. And while prevention's good, it's not always as easy, and it's more philosophical. It's not always as easy to be motivated. So with that being said, we're about to go over your x-rays. When we go over your x-rays, there's a couple of things about this morning's appointment. First of all, care about yourself. Make your appointments, follow the recommendations. You'll see the results that you want to, but you have to be here. You know, one of my best mentors one time told me, you do not want to have a codependent relationship with a client. It has to be your responsibility to take care of your health. And as long as you do that, we see excellent results here. You'll see excellent results. The second thing is, when you do feel like this is a great place to be healthy, we ask you very simply to tell people what you're doing. I can't tell you how many people their first, she raised your hand, because there was a friend, a coworker, yeah. And that's almost universal. But the reason that we ask that is there's so many people that start their appointment with, I wish I would have known about this sooner. On Monday this week, I had somebody, it was her third adjustment. She went through her x-rays just like you're all about to do. And she said, you know, I've wanted to do this for 10 years, but my doctor told me not to. And instead I sat here miserable for the last decade. And I say that only not because anybody's doctor's, but the reality is some people just don't know and would love to feel better and be healthier. So if you're willing to do that, we'll get you started this morning. There are 2 doctors going over x-rays. It typically takes about 5 minutes per person. And I will also tell you this is your last long appointment. So everybody should be done within 15 or 20 minutes, okay? Thanks for your time.